Greetings, everyone. I'm Eric Hong, Executive Director of the Momiji Healthcare Society. This is my second video message to residents of the Momiji Seniors Residence and their family. Many of you have no doubt been following the news about COVID-19 as a pandemic. The early COVID-19 cases in Canada have been largely traceable to travelers to affected areas outside of this country. The situation has changed significantly since. The number of confirmed cases in Toronto and other parts of the country has been rising dramatically. As of Wednesday, March 25th, there are now 3,385 confirmed cases of COVID-19 across Canada. Of these, 688 are in Ontario, and 319 of them are in the City of Toronto. COVID-19 that is of greatest threat to older adults who might already have suffered from other underlying medical conditions and are compromised in their immune system is now considered to be in community transmission among people. It means that it is easily transmitted when people come into close contact with each other. People may or may not be aware that he or she is already infected or is a carrier of the virus. To date, there is no vaccine known to be effective against COVID-19. There is also no specific treatment for this flu-like disease. As of March 25th, there have already been 35 people in Canada who have died from this infection. Public health authorities are urging that individuals practice heightened personal hygiene that includes washing hands with soap and water often, or using an alcohol-based hand sanitizer when soap and water is not readily available. They also recommend that people practice social distancing. That means minimizing being in close contact with each other. And close contact is defined as being in sitting or standing close to each other within 6 feet. And also advises against group gatherings. Anybody experiencing flu-like symptoms such as a worsening cough, a fever, or difficulty breathing is to self-quarantine at home and seek to be assessed by a healthcare professional as soon as possible. It also went on to recommend that all persons aged 70 or over to self-isolate at home for 14 days even if you are not experiencing any flu-like symptoms. This is to minimize your exposure to other people and to public places where the risk of catching COVID-19 is high. To support the practice of social distancing, Momiji is stopping all group programs in the Seniors Active Living Center. We are suspending education classes so as to reduce the number of people coming in and out of Momiji premises. We are stopping communal dining in Zero-Sun Restaurant and at the Wednesday Western Lunch program. Instead, we are delivering pre-ordered meals to tenants' apartments instead. We are also urging the families and friends of tenants and Momiji to moderate and minimize their visits to Momiji as much as possible. I am aware that there is concern about Momiji reducing its services at this time. Momiji operates with a very small number of staff to begin with. We are concerned that even with one staff catching COVID-19, it will necessitate for everyone who work here to go on quarantine. With no staff available to work, it will be impossible for our assisted living program to continue. We have therefore divided our staff into 2 teams, each one of them working on alternate days. This minimizes the risk of the entire staff group having to be quarantined. That has unfortunately required for essential services to be reduced to a minimum level. We have been asked by families of tenants whether they should continue to visit their loved ones at Momiji. It is a difficult question to answer. Social isolation might be an unintended side effect of social distancing as we try to prevent infection. In practicing social distancing, there are fewer opportunities for tenants to socialize. In order to minimize the risk of inadvertent infection, staff has had to cut back on time spent with tenants. Some tenants might be relying on their families to visit in person and to keep in touch, and even provide practical assistance like shopping for necessities, since the tenants themselves are unable to go shopping. I can only suggest that families minimize their in-person visits if at all possible. And I also suggest that tenants and families try and shift to other means of communication to stay in touch. These might include connecting by telephone more often, using video conferencing, FaceTime, Skype are possible avenues. Families minimizing the number of shopping deliveries undertaking to once a week as opposed to every other day might also help. Tenants and families need to weigh and balance safety from infection concerns against the need for social connectedness. In the meantime, Momiji is exploring alternative means to help our tenants shop for groceries and necessities. We are looking into bulk ordering and buying on behalf of tenants. We might be using grocery shopping and delivery services. But any of these means or methods may mean that individual tenants have less choices in what particular product they want to acquire. Please also be advised that at these times, there are unfortunately fraudsters and scammers who are preying on the vulnerable. Toronto Community Housing has warned that there are reports of people claiming to be volunteers, calling on people and saying that they are offering grocery home deliveries and requesting that people provide them with banking information over the phone. They are not true. They are not real. If you receive such calls, please verify with Momiji Support Services staff. Momiji staff would never ask for such information over the phone. These are extraordinary and difficult times. Momiji will continue to strive to protect and support our tenants and our clients. We welcome suggestions and will do our best to collaborate with our clients and their families to weather this COVID-19 storm. We thank you for your patience and your collaboration. Thank you.